The roots of racism and oppression lie partially in the denial of personal trauma and projection on the other. These projections continue to wound our collective soul, as we also take on soul guilt, clinically known as moral injury. Beyond that, all of us can learn invaluable concepts and strategies that we can apply directly in our own practice. Duran's case examples represent Native people, but all of the cases have direct implications for our own work. This is not just a new way of thinking. It is also a culturally specific approach that has profound implications for all counseling and therapy. The fierce urgency of the moment we live in requires that we attend to the healing of our collective soul. Therapeutic interventions described in this book give us a pathway into healing our soul, which is of many colors. You can tell that I'm a believer. I first encountered Eduardo Duran in the pages of the book, co-authored with Bonnie Duran, Native American Post-Colonial Psychology. That book is a classic. It also is must-reading. In this new book, the notion of post-coloniality discussed in his earlier work is transformed into what Duran calls liberation psychology, which represents the next level of healing once awareness of the genesis of trauma is made conscious. Taken together, these two books have changed the way I think about counseling and therapy. This new and current work moves to the next level as it combines exciting theory with highly useful pragmatics of clinical practice. Let us all join with Eduardo Duran's view of the past, present, and future. Alan E. Ivey, Doctorate in Education, American Board of Professional Psychology. Distinguished University Professor, Emeritus, University of Massachusetts Amherst. Professor, University of South Florida, Tampa. Introduction. Liberation discourse involves taking a critical eye to the processes of colonization that have had a deep impact on the identity of indigenous peoples. As a result, a new narrative of healing will emerge. The mental health profession has been instrumental in fostering the colonial ideation of Native peoples all over the world. I am merely bearing witness and bringing awareness to this process, to change it. By turning a critical eye on our professional activities of healing, we liberate ourselves as well. If we simply observe, transformation and change will occur as natural law dictates. In both psychology and physics, having an observer changes the dynamic of the situation. The observer can be an internal or external one. It was with some trepidation that I agreed to expand and revise the present book. When I was writing the first edition, my thinking was conflicted as to how much Western interpretation I was to offer as I began to embroider the fabric of the clinical work with academic language and theoretical constructs. In my discussions with Alan Ivey, he let me know in very certain terms that he would like to see the real stuff, whatever that is. This was very challenging to me because he was asking from his heart and was speaking with the voice of an elder. I took his request very seriously and struggled with how to do it. I wondered what could happen and how this work would be received. Much of the clinical work that I had done previously was an alchemical amalgamation of Western theory and traditional indigenous theory and practice. At the beginning of my clinical work, internal conflicts arose as I felt that I was pushing the theoretical Western envelope too far. It became necessary to continue testing theoretical and clinical limits because there was not much in the literature that encompassed relevant and effective treatment methods. After careful meditation and prayer, I decided to move ahead with the project, and what follows is the result of an elder asking for a talk on how to heal the soul wound. I purposely used indigenous terms without operationally defining these. My reasoning is that by exposing the Western therapist to a new idea, perhaps therapists will gain understanding as to how indigenous patients feel when they are presented with Western diagnoses and treatment modalities without context. Hopefully, Western therapists can then take on a serious study of the cosmology of the community they are working with, and in so doing, become more effective in offering succor to the suffering that has its roots in historical trauma. Our profession would then truly be on the path of discovering new, trauma-informed treatments. The book has now been out in the world for over 10 years.